Hi, my name is Rebecca Heisen. I'm a pediatrician, and I, along with Dr. Shannon Madison, who's an OB-GYN doctor, I'm going to talk today about doing direct primary care in OB-GYN and pediatrics. Direct primary care is a model of medicine in which patients pay a membership fee to cover a scope of medical practices. It's most common for primary care, but also there's an increasing number of specialists using this model. Basically, it's a model of cutting out the middleman. Nationwide, the average cost that people pay is $75 a month per adult. This is an alternative to fee-for-service insurance billing. It avoids the complexity and overhead of maintaining relationships with insurers. It's also been called concierge medicine for the masses. Usually the membership fee is paid directly by the patient, but sometimes it's paid by the employer. And in this model, physicians are working directly for their patients, not for the insurance company. Some direct primary care offices are pure and some are hybrid. About 80% are pure, and this means that the office does not bill insurance at all. Patients still can have insurance and they can use that insurance for specialty visits or ER, hospital care, but the office does not bill to the insurance. And then a lot of the other offices are hybrid, which means they have some kind of arrangement where people pay a monthly fee, but also their insurance is actually billed in the office. Most of these offices don't charge any kind of copay for a well visit or a sick visit. And many of the direct primary care offices will offer some kind of prescription medicines in-house. Now, we can't call it a pharmacy if we don't have a pharmacist there, but have like a dispensary where people can get low cost or medications that are just included in their membership. However, there are 11 states that prohibit or severely restrict direct primary care offices doing this. The average patient panel for a family practice doctor is about 600 patients. And on average, it takes about 20 months for a direct primary care physician to build up to this volume. Direct primary care is growing very rapidly in the US. Currently, there's more than 250,000 Americans who are members of DPC offices. In 2005, there were about 150 DPC physicians, but now there are thousands. And many offices are only a few years old. In a 2018 study from the American Academy of Family Practitioners, 72% of DPC offices had only been open for 1 to 3 years. Here is a map of DPC offices that have registered on a popular website called dpcfrontier.com. So when I first was doing a presentation in 2017, there were only 687 offices. Now there are over 1,200 offices. So the green dots represent pure direct primary care offices, which is most of them, about 80%. The red offices are hybrids. The blue are on-site for corporations, and the yellow ones are unknown. 21 states have favorable laws for direct primary care practices. Hopefully you don't live in Oregon if you're interested in doing direct primary care, because that's the only state that really is not very favorable for direct primary care. Funding is a powerful source of control. So one of the biggest benefits of DPC is having additional autonomy from third parties. The majority of the mechanisms the government and insurance companies use to dictate physicians how to practice medicine are tied to payment. So doing direct primary care removes conflict of interest, such as from insurance company incentives. So instead of being financially incentivized to override patient autonomy, direct primary care offices allow physicians to focus just on what is best for their patients without being distracted by meeting artificial quality measures and all the associated documentation and other requirements that come along with that. Direct primary care doctors often feel that they give better patient care by being able to have a much smaller patient panel, having longer visit times, and having an environment that's more conducive to relationship building. The that you can really address the needs of your patient's spirit, soul, and body thoroughly. Direct primary care offices often can give care in more convenient ways to a patient because they're not dependent on the patient to actually come into the office to get paid for by insurance. Financial stewardship is also a very important part of direct primary care. Practicing medicine is so much cheaper without an insurance company being involved. It really blew my mind when we first set up our office. About 40% of office revenue typically goes to insurance-related expenses. And labs and medications are so much cheaper when you don't use a third-party payer. For instance, we cover CBCs and complete metabolic panels for our patients, as well as a lot of other labs, because many of them are less than $3 or $4. We also cover radiology readings for x-rays, which are only about $8 to $9 to have a radiologist read those. Many DPCs will negotiate rates for specialty services and advanced testing for their patients. And we have, for example, already built quite a network of providers that will give discounts to our patients. And being part of a DPC office usually results in less emergency department and urgent care visits, so that adds up to a lot of savings for our patients in the medical system in general. So DPC offices are often a great financial fit for patients with health sharing ministries, which is about 1 million Americans who participate in these organizations. There are 4 Christian health share ministries, and I'm aware of 2 secular ones. Also a great fit for people who have high deductible insurances, which is now about 30% of American employees, and for people who don't have other healthcare coverage. There are challenges in direct primary care. One is that it can just be difficult to get people out of the mindset that they must have traditional insurance and that must pay for their primary care services. The concept in our area seems to be most welcomed by the Christian health sharing ministry members, who are often people who are already more likely to think outside of the box. The startup of a new office, of course, can be financially challenging, and if you're going from a traditional medical office to a DPC office, especially if you're going to go pure DPC, you're probably going to lose a fair amount of your patients who have insurance. So now to tell more about our direct primary care office that's called Christian Healthcare Centers. Our main vision was to create a network of medical centers across the nation where medicine could be practiced from a distinctively Christian point of view, addressing people's needs, spirit, soul, and body, and not controlled by outside sources. One of our founders is a medical ethicist who had been recognizing for decades that the freedoms of providers were decreasing. I joined in 7 months before we opened, and this truly was an oasis for me. I had refused to support radical LGBT measures in Michigan schools, and after I wrote a respectful letter regarding why I felt this way, I found myself without a job and essentially blacklisted among most of the pediatricians in my community. So I was so thankful that God provided Christian healthcare centers where I can freely practice medicine according to Christian values. So we are a pure DPC office. We don't do any billing of insurance. We do scan patients' insurance card, and we will send that on if they need to go to specialists or we're ordering imaging or labs, but we don't do any of the billing to insurance. We have 2 internal medicine doctors, 2 family practice mid-levels, 1 OB-GYN doctor, Dr. Madison, 1 pediatrician, me, and 1 counselor. All right, so this is our price structure. Adults are $80 a month. Children are $10 a month. Unless they're under 2, then they are $25 a month since they require more care. College students are only $30 a month. Out of respect to seniors, we actually give them a little discount, and if you're 62 and older, it's only $70 a month. So for a family of 4, if there weren't any kids under 2 and the parents weren't senior, it'd be $180 a month. So the members get all their sick and well visits included. They get counseling services, x-rays, and other like urgent care level services included, and many prescription medications we have in our dispensary, which is, here's a picture of our dispensary right here, that many of the medicines are either included or offered at very low cost. So the majority of our members participate in health sharing ministries, as I mentioned before. So these are the 4 different Christian health share ministries. We have a large predominance of Samaritan ministries. One reason is because they actually helped us to start, and they really promote our office to their members, and even have run promotions like covering 3 months of membership or giving a very discounted rate for their members to come. So that has been a huge boost to our growth. So we have 39% of our members participate with Samaritan Ministries, 4% with MediShare, 6% with Christian Healthcare Ministries, and 3% with Liberty Health Share. And as I mentioned before, there are 2 secular health share ministries, but I'm not aware that we have members of either of those, because most of our members are Christians. We have 32% of members with traditional insurance, and then 16% who don't have any insurance or health share ministry. Our future vision is that currently we're seriously working on opening up 2 other centers, and then the big vision is that we hope to someday have 100 centers across the nation. So as far as practicing pediatrics, specifically DPC style, there are only a small percentage of pediatricians in the DPC world. It is increasing. 2018 survey of DPC practices indicated that 13% of DPC offices have at least one pediatrician. And many pediatricians who practice DPC style do at least some house calls. That could be after hours, or for like your newborn hospital visit and the 2-week checkup are the most common ones. I do some house calls, but I don't do that many. So some of the specific advantages of doing DPC in pediatrics. The first one, and the one that probably means the most to me, is that we have nice long appointment times. Our standard well check time is 60 minutes, which is awesome. We don't always use all that time, but a lot of times we do. And sick visits are usually 30 minutes. This really helps to establish better and more meaningful relationships. And I'm amazed at how this really cuts down on sick visits, because we really have a lot of time to discuss things like asthma and constipation management in depth. Also, it means that our patients really have low rates of needing to go to emergency department and urgent care. We have really high level of patient satisfaction, which really helps with job satisfaction also. I love not having to chase after insurance company incentives for chlamydia testing and vaccines and all the other common ones in pediatrics. We at Christian Healthcare Centers have counseling in-house, which really is a blessing, because that takes out the financial barrier for people to get mental health help. At the end of the workday here, I definitely feel less exhausted than when I saw many more patients, and I feel like I've given less hurried and more thorough care. There are definitely challenges with doing pediatrics DPC style. One of the big ones, and a reason that I think deters a lot of pediatricians from doing DPC, is the issue of vaccines. In our office, because about 70% of our pediatric patients are eligible for a vaccine for children, we use that program, and that really usually helps things just work out pretty well as far as vaccines go. For those other 30% that aren't eligible for VFC, we do a limited number of cash pay vaccines just based on patients' wants, or I will help direct them like with their specific insurance where they can go. Once kids are 4 and above, they can go to a pharmacy, so then it becomes less complicated. It can also be challenging to be highly accessible to patients. In our office, the providers vary somewhat for how exactly they're accessible to patients after hours, but in DPC in general, there's the idea of trying to be more accessible to patients. And when patients don't have insurance or they have a $10,000 deductible, it really means a lot to them. We can help them after hours. That just is a constant issue, especially for me, to try to balance. And working with families who don't have insurance or have a very high deductible can also be tricky when it comes to specialty care. So I end up doing a lot more care that I might have referred to a specialist before in a traditional medical office for patients, especially who just cannot afford to go to a specialist, or that it'd be a really big barrier. And now I will hand it over to Dr. Madison, our OB-GYN doctor.
Good morning, I'm Dr. Madison. I'm the OB-GYN for Christian Healthcare Centers. I'm here to talk to you a little bit about direct primary care and how obstetrics and gynecology fits into that model. As ACOG tells us all the time, we are primary care providers, but we're also surgeons, and sometimes marrying those two in a direct primary care format can be a little bit challenging, but very rewarding at the same time. So some of you might be wondering how common it is to have an OB-GYN working in a direct primary care setting. As of 2018, with a survey done by the Direct Primary Care Frontier, there are only 3% of direct primary care practices that offer obstetric services, and those are with family practice providers. There is currently actually only one practice in the country that offers obstetric services that I'm aware of, and that's located in Utah right now. And at that practice, like I said, the care is provided by family practice providers. I don't know of any current OB-GYNs that are directly and completely committed to a direct primary care model. So our team of OB-GYN care at Christian Healthcare Centers consists of many different people. I'm really fortunate to have two sonographers who are fantastic and help me with all my obstetric scans and gynecologic scans as well. I have a certified lactation consultant who's fabulous with our patients, and I also have a dedicated OB nurse who has former experience as a labor and delivery nurse, which comes in handy sometimes. So for patients to be receiving their obstetric care through Christian Healthcare Centers, they do not actually have to be members. So as Dr. Heisen had discussed earlier, we do have a monthly membership fee, but obstetrics is outside of that. And so for people who aren't members but are interested in care, they can apply for our maternity care program, which is a grand total of $3,000, and that includes all of their antenatal appointments, postpartum care, and labor and delivery physician fee as well. Also, if they are interested in just coming for a GYN consultation to meet me and discuss an issue, that is an option as well, and that's a $120 charge if you're not a member. So it's certainly advantageous to be a member because that would be included in their member care. There are many advantages to practicing obstetrics and gynecology in a direct primary care practice setting. First and foremost, as Dr. Heisen had said, for pediatrics, it's the same for gynecology and obstetrics. I get 90 minutes with a new patient appointment, which allows me ample time to really get at the root of the issue and get to know my patients really well. And then my routine OB appointments are 30 minutes. And it really just helps me to establish a trusting relationship with my patients. And one of the advantages of being the only OB-GYN here is I'm the same provider who provides the prenatal care and also delivers the patients at the end of the day. And having these relationships where I really get to know my patients and can spend quality time educating them has really led to much fewer after-hours calls than I'm used to. So I alluded to this slide a little bit earlier as far as what is included in maternity care. So it's pretty comprehensive. All routine prenatal labs, all ultrasounds, any indicated antepartum testing, so non-stress tests, AFIs, BPPs, all prenatal visits, my physician fee for labor and delivery, all their postpartum visits. I like to do a 2-week postpartum visit and a 6-week postpartum visit. And at the 1-week mark, my nurse will call and check in on the patient, make sure they're doing okay as well. And then if they're having any trouble with lactation, then I have my certified lactation consultant who can meet with them on the phone or in person. And that's been really beneficial to a lot of my patients. Things that are not included in maternity care. So because it is a general bundle, there are certain things that are outside of that. And in this case, genetic testing is certainly one aspect of prenatal care that is optional and therefore not included in our bundle, but it is a possibility. We actually have a pretty good deal with a lab to offer a genetic screening panel, cell-free fetal DNA, for $395 for uninsured patients, which is fantastic and pretty unheard of. And then if a patient develops a complicated pregnancy, multi-fetal gestation, low-lying placenta, previa, etc., then a referral to an MFM would not be included in care. And so since a lot of our patients do belong to these health sharing ministries, they're able to cover that cost with their health sharing ministry organization. And then hospital fees for labor and delivery or anesthesia fees for an epidural or a spinal are not included in that as well. And Dr. Heisen had discussed this earlier as well. There's one little additional caveat for pregnant patients, since a lot of them will have Medicaid or qualify for Medicaid. They often will use Medicaid to cover their hospital fees or any referrals out to an MFM or other care outside of what we provide here. And for patients that are completely uninsured, there are certain cash pay discounts. So for example, if the entire anesthesia bill is paid within 30 days after they receive the bill, then there's a 50% discount for those patients, which helps a little bit. So this is a photo of our most recent addition to the CHC family. This little guy down here was our very first baby that I delivered through CHC. And then we've got the mom, one of my sonographers, my lactation consultant, and myself. And it's really been a growing practice. So first quarter of the year, we're looking at about a half baby per month. Second quarter, it's about 1 baby per month. Third quarter, about 1.5 babies per month. And then fourth quarter, I've got 4 ladies due in October, so we'll see how that goes. It's getting pretty busy. So as far as gynecology goes, at Christian Healthcare Centers, we provide a pretty broad array of services, everything from pap smears to colposcopies, leaps, in-office biopsies, and certainly diagnosis and treatment for common conditions, abnormal uterine bleeding, pelvic pain, prolapse, incontinence, and those sorts of things. And as far as cost for these, since again, as an OBGYN, we are part primary care and part specialty services, most of what I do is included in membership, but certain things that are specific to a patient and not a general rule of thumb for everyone, such as colposcopies or leaps, are not included and do have an additional fee associated with those. But we try to keep it as reasonable as possible. Most of the fees that we charge are really to pay the pathologist to read the tissue and give me an answer as to whether it's benign or malignant. And then as far as diagnosis and treatment for common gynecologic conditions, the initial consult is included in member care as well. And then if they have any additional issues or concerns that are very specific to gynecology, so they need a pessary fitting or a bladder installation, then that would be something that has an additional charge because it's more of a specialty service and not directly primary care. So similar to obstetrics at CHC, our gynecologic appointments are nice and lengthy. I have 90-minute appointments for my new patients, which allows me to address everything from hormone replacement therapy for their vasomotor symptoms, an endometrial biopsy perhaps for their abnormal uterine bleeding, talking about options and treatment for their dyspareunia. So it's really great because I can address all of that in addition to their routine well woman things such as making sure they're up to date on their colonoscopy and their mammogram. And I really enjoy having that time to not only be as thorough medically as I can, but really getting to know the patient and seeing what's driving them and what their real concern is, and being able to get to the root of some of the issues of more complex medical problems. As far as challenges of gynecology at a direct primary care practice, there certainly are some. I think overall the benefits far outweigh the challenges, though. It can be difficult sometimes to work with patients who need surgery but don't have any sort of insurance. For the ones who have a cost-sharing ministry, it's been much easier to get that accomplished for them. But cost is really a very big issue for a lot of our patients. Many of them are self-employed and don't have insurance. And so especially for the ones that don't belong to a cost-sharing organization, it can be more difficult to find a way to make surgery financially feasible for them and to convince them that it's worthwhile for them as well. In addition, this has been a huge blessing, but we have such a low-risk population, with most of our patients being Christian. They're often in married monogamous relationships, which leads to decreased pathology. I have very few abnormal pap smears, which has been wonderful. And a lot of our patients are very health conscious and take good care of themselves, both physically and spiritually. And another challenge is that a lot of patients that come to a DPC, besides the ones who join for the Christian values or join for the decreased financial burden compared to commercial insurance, they have a very natural and homeopathic mindset, and so it can be more challenging sometimes to work with patients that are skeptical of Western medicine, and so that can definitely be more challenging, but not just in gynecology, that applies to pediatrics as well too. And really at the end of the day, just trying to figure out what's best for the patient and coming up with a solution that they're comfortable with is really what matters. But usually that doesn't mean treating their abnormal uterine bleeding and just making sure that it's not malignant. So overall, at the end of the day, what's really most important to us here at Christian Healthcare Centers, it's not just about the time we get with our patients or the lack of dealing with insurance. The room that we're standing in now to give our presentation, when this belonged to a traditional office, used to be full of billers, just dealing with insurance companies, and now it's our conference room. So we've definitely come a long way and are trying to make some changes to how medicine is practiced. And I would say that I really love this little quote here, but our medical skills are gifts that are provided to us by the great physician, through which we can improve the lives of individuals and point them to Christ as the Redeemer. And that's really the heart and the soul of this mission.